Have you ever wondered why global health matters to every individual regardless of where they live? We're going to dive deep into that question today. In our modern, interconnected world, health is a global issue. It's not confined by national borders or limited to specific regions. A virus born in one part of the world can, within a matter of days, spread across continents, affecting millions. This is no longer a theoretical scenario as we've witnessed firsthand with recent pandemics. But it's not just about infectious diseases. Non-communicable diseases such as heart disease, diabetes, and cancer are also part of the global health equation. These chronic conditions are not restricted by geography, socioeconomic status, or culture. They impact people everywhere, from the bustling cities of the developed world to the remote villages of developing nations. This global health landscape underscores the importance of understanding and addressing health issues on a global scale. But why should you, sitting at home, care about health issues that might seem far removed from your daily life? Well, the answer is simple. The state of global health affects us all. It impacts our economies, our security, and our future. An outbreak in a distant country can lead to a global recession. A spike in chronic illness rates can strain our healthcare systems. A rise in antibiotic resistance can endanger medical advancements. Moreover, addressing global health is not merely a moral imperative. It's a practical necessity. By working to improve health conditions across the globe, we safeguard our own health. We contribute to the development of healthier societies and, in turn, a healthier world. Global health is a complex tapestry of interconnected issues. It requires collective action, informed decisions, and relentless effort. It demands that we think beyond our borders and consider the health of our global community. So, global health isn't just about them, it's about us, too. To understand the present, we must look at the past. Our journey begins with the Spanish flu, a lethal influenza pandemic that swept the globe in the early 20th century. It was a time of great strife, with the world reeling from the aftermath of the First World War. The Spanish flu, in its merciless spread, infected nearly a third of the world's population, causing an estimated 50 million deaths. It was a pandemic that knew no borders, a health crisis that called for a global response. Yet, even in the face of such a devastating pandemic, humanity persevered. We learned, adapted, and developed measures to combat this invisible enemy. Health organizations sprung up around the world, working tirelessly to contain the spread of the disease and treat those affected. It was a time of great learning and progress, a time when the world came together to fight a common enemy. Next, we turn our attention to smallpox, a disease that has plagued humanity for thousands of years. This highly contagious and deadly disease claimed countless lives throughout history, leaving survivors with severe scars. But humanity's struggle against smallpox is a story of triumph. In the mid-20th century, the World Health Organization launched an intensive global smallpox eradication campaign. After decades of relentless efforts, smallpox became the first disease to be eradicated by human effort in 1979. Our journey through the past health burden would not be complete without mentioning the plague, a disease that has caused 3 major pandemics in history. The most notorious of these was the Black Death in the 14th century, which wiped out nearly a third of Europe's population. But despite the massive death tolls, these outbreaks led to significant advancements in public health. Cities started developing sanitation systems, quarantine measures were established, and the concept of public health took root. In the face of these major outbreaks, the world learned the importance of a unified response. Nations realized that diseases do not respect borders, and that a health crisis in one part of the world can quickly become a global problem. This led to the establishment of various health organizations, both at the national and international level. These organizations have been instrumental in coordinating responses to health crises, researching new treatments, and implementing health policies. These diseases, as devastating as they were, shaped our approach to global health. They taught us the importance of preparedness, of swift and coordinated action, and of the value of medical research. They showed us that in the face of a global health crisis, we are stronger together. So, as we delve deeper into the topic of global health burden, let's not forget these lessons from our past. They serve as a reminder of what we can achieve when we work together, of the progress we can make in the face of adversity. These diseases shaped our approach to global health, leading to the establishment of various health organizations and policies. Fast forward to the present day, our health challenges have evolved. It's like we've traded our swords and shields for stethoscopes and lab coats. We no longer battle monstrous beasts but microscopic ones, and the battlefield has shifted from the physical world to the microscopic realm of cells and viruses. The health burdens of today are less about infectious diseases and more about non-communicable ones. These are illnesses that can't be passed from person to person, but develop over time due to a combination of genetic, physiological, environmental, and behavioral factors. They've become the silent killers of our time, stealthy and persistent. Let's take a look at some of these non-communicable diseases. First, we have cancer, a disease characterized by the uncontrolled growth and spread of abnormal cells. It's like a rebel faction within our bodies, waging war against the rest. And it's a formidable foe, taking millions of lives each year. Next, we have diabetes, a condition where the body either doesn't produce enough insulin or can't effectively use the insulin it has. It's like having a broken fuel pump in a car. The fuel is there, but it's not being properly utilized. As a result, the body's energy production is disrupted, leading to a host of health complications. Then there's heart disease, the leading cause of death worldwide. It's like a time bomb ticking away in our chests, triggered by factors like unhealthy eating, lack of physical activity, and stress. The explosion can result in a heart attack, stroke, or other cardiovascular complications. But non-communicable diseases aren't our only concern. We're also grappling with a global pandemic. COVID-19 has swept across the globe, leaving a trail of devastation in its wake. It's like a storm that we didn't see coming, catching us off guard and forcing us to adapt to a new normal. COVID-19 has not only claimed lives, but has also strained health systems, disrupted economies, and exacerbated social inequalities. It's a stark reminder that our health is interconnected, that a virus in one part of the world can quickly become a global problem. So where does this leave us? We're in a battle, yes, but it's not a hopeless one. We have the knowledge, the technology, and the determination to fight these health burdens. We're learning to prevent and manage non-communicable diseases, and we're making strides in the fight against COVID-19. But we can't do it alone. These current health challenges require a global response, as no nation can tackle them alone. It's a call for unity, for collective action. After all, when it comes to health, we're all in this together. The global health burden does not only affect our health but also our economies and social structures. Let's start by dissecting the economic impacts. When a significant percentage of the population is sick, the cost of healthcare skyrockets. This doesn't just mean higher medical bills for individuals, but it also translates into increased spending for governments and insurance companies. These added expenditures can lead to higher taxes and insurance premiums for everyone, sick or not. But that's not all. When people are in poor health, they are less productive. They may miss work or school, and even when they do show up, they might not perform at their best. This loss of productivity can have a ripple effect throughout the economy, leading to lower profits for businesses and slower economic growth. Now let's switch gears and talk about the impact on social structures. When individuals are too sick to work or care for their families, the burden often falls on others in the community. This can lead to increased stress and burnout among caregivers, which in turn can exacerbate health issues and create a vicious cycle of poor health. Moreover, health disparities between different social groups can lead to social unrest. Those who are disadvantaged often have less access to quality health care, leading to poorer health outcomes. This inequality can breed resentment and conflict, further destabilizing societies. So you see, the global health burden isn't just a matter of personal well-being, it's a complex issue that affects every aspect of our lives, from our wallets to our workplaces to our communities. It's a problem that demands our attention, not only because it's a matter of life and death, but also because it has far-reaching implications for our global economy and societal harmony. Indeed, the global health burden is a major obstacle to sustainable development. You might be asking, what can I do to contribute to global health? Well, it's not as daunting as it might seem. Each one of us can play a crucial role in promoting global health, and it starts with the choices we make every day. First, adopting a healthy lifestyle is a fundamental step. This isn't just about going to the gym or cutting out junk food. It's about making conscious decisions to enhance our well-being and, by extension, the health of our communities. This could mean choosing to walk or cycle instead of driving, opting for fruits and vegetables over processed foods, or simply taking time each day to relax and de-stress. Each of these choices not only improves our personal health, but also reduces the strain on our health systems. Second, Participating in vaccination programs is vital. Vaccines have been instrumental in eradicating diseases and saving countless lives. By getting vaccinated, we not only protect ourselves, but also contribute to herd immunity, which safeguards those who are unable to get vaccinated. Remember, the influenza shot you get each year does more than just keep you from getting sick. It's a contribution to the global fight against disease. Lastly, we can advocate for health policies that promote equity and access. This might mean lobbying for policies that ensure everyone has access to clean water and nutritious food, or it could involve supporting initiatives that aim to reduce health disparities. By using our voices, we can help shape a healthier, more equitable world. Each of these actions may seem small in isolation, but together they can have a significant impact. Global health isn't just about grand gestures or large-scale initiatives, it's about the everyday choices each one of us makes. So next time you're about to make a health decision, remember, it's not just about you. It's about all of us. Every action counts. Your health choices can contribute to a healthier world. As we've seen, global health is a complex, ever-evolving issue. It's a vast, intricate puzzle with pieces spanning continents, cultures, and centuries. But let's take a moment to remember the journey we've embarked on today and the key points we've discussed. In the past, global health was primarily concerned with combating infectious diseases and improving child and maternal health. We've made remarkable strides in these areas, but the health landscape has changed dramatically. Today, we're grappling with a new set of challenges, from non-communicable diseases like heart disease and diabetes to mental health issues and the health impacts of climate change. The present health burden is, without a doubt, a multifaceted beast. It's not just about the diseases themselves, but also about the social, economic, and environmental factors that influence health. Poverty, inequality, and lack of access to quality healthcare are just a few of the many threads woven into the tapestry of global health. This brings us to the impact of the global health burden. It's an issue that reaches beyond the individual, affecting families, communities, and nations. It slows economic growth, exacerbates social inequalities, and hampers efforts to achieve sustainable development. The repercussions of poor health are felt far and wide, rippling out in waves that touch every corner of our world. Now you might be wondering, what can I do about all this? Well, that's where the role of individuals in global health comes in. Each one of us has a part to play, whether it's making healthy lifestyle choices, advocating for health equity, or supporting research and initiatives aimed at improving global health. It's important to understand that addressing these health issues is not just the responsibility of governments or international organizations. It's a collective effort. Each one of us in our own way can make a difference. As we move forward, let's remember the importance of understanding and addressing global health issues. Let's strive to stay informed, to be compassionate, and to take action where we can. Let's remember that every decision we make, every action we take, has the potential to impact the health of others, near and far. So, as we conclude this journey, let's take these insights with us. Let's carry them into our daily lives, into our conversations, and into our actions. Let's use them as a compass, guiding us towards a healthier, more equitable world. Remember, in the realm of global health, we are all interconnected. Your health is my health. Our health is global health.